And happy Friday. I hope you're not freezing in Austin, Texas. We are here today to speak about a common issue that unfortunately a lot of people have. It's migraines and TMJ disorders. And I have the best expert with me today. It's Dr. Ivonne Gonzales. She's a physical therapist and the founder of Mind Body Physiotherapy. And she helps people with managing this kind of disorders and handling pain in a healthy way. So we're going to ask Dr. Gonzales to tell us all about migraines, all about, I don't know if I can say this word correctly, temporomandibular joint disorders and how they can, yay, my victory for the day. Hi, Dr. Gonzales. Welcome.
Hi.
Can you tell us a little bit about yourself and what you do?
Of course. Thank you so much for that intro. So my name is Ivonne Gonzales, and I'm a physical therapist. Do have a doctorate in physical therapy, and I do treat all orthopedic conditions. However, my special love and joy is helping people that have jaw disorders and also tension type headaches or migraines. And so I'll just talk a little bit more about what we do at Mind Body Physiotherapy. So it is not your traditional physical therapy clinic. Unfortunately, with the insurance-based models and some of the in-network clinics, we don't have the ability to spend the full hour with a patient, and they really require a lot of attention, and especially with these conditions. So we're definitely not a traditional physical therapy clinic. All of our appointment sessions are 100% one-on-one. And so like I said, we treat all orthopedic conditions. So if you have knee pain, back pain, really anything. But we do have a special focus on TMJD, which is jaw disorders, and orofacial pain and tension type headaches. So today, what I want to talk about a little more is just diving deeper into the condition of jaw disorders, what tension type headaches are, what a migraine is, a little bit about posture and how they relate. And I'm also going to share some treatment methods to help anybody, if somebody's having some of these conditions already, some treatment methods so that you can get started on your pain healing journey.
Wonderful.
So just a little bit of background with TMJD and migraines. So the reason why I think it's so important specifically to talk about it with this group is because unfortunately it is a lot more prevalent in women. So jaw disorders, 100% more prevalent in women than men. So a few studies showed that there is a 2 to 4 times more likely to happen in women than in men. To experience masticatory muscle pain. So masticatory is just all of your chewing muscles, which we have 4 of them, and I will talk about them here in a second. Also, there's a global prevalence of migraines that is higher in women than in men. So 20.7 in women and 9.7 in men. Same thing with the migraine population. Migraines are also more prevalent, 3 to 4 times more frequently seen in women than men. So unfortunately, there isn't an exact reason for it, or it's not fully understood. A lot of studies do discuss that it could be hormonal factors and the fluctuations in estrogen level. There is another that talks about genetics. Unfortunately, stress and depression are also linked higher in women. And hypermobility is another one, which there's some studies that I did find that there's more joint laxity that is reported, especially after puberty. Again, more prevalent in females versus males. And also, more of the higher levels of pain, and also the intensity of pain is also rated higher with women than men. So these are all things that with hypermobility, there isn't exactly a way to say fix that, but there's a way to mitigate it, and that is through creating more strength and stability in our muscles. And then the last one, the musculoskeletal, so MSK is musculoskeletal. It is also, they have seen that the the anatomy, so like the structures and our bones and the way, like especially like in our hips and the way we're built as women, the areas in which some of the joints articulate or come together, they are a little bit more smooth, and so men's are a little bit rougher. So there is that hypermobility again, where if your joints are a little bit more smooth, they probably don't catch enough traction. So we are just anatomically made different, which again, unfortunately, there is pain or higher prevalence of pain and disorders associated with it. But the good thing is that there's something that you can do about it. So I want to discuss a little bit what the TMJ is. I know that I get a lot of patients that say, oh, I've had TMJ for years. And so actually TMJ is the joint. So we all have that joint, but the actual condition is TMD. So it is temporomandibular disorders. So TMJ is a hinge joint that connects your mandible to your cheekbone. And the dysfunction to this joint can lead to restrictions of movement of the jaw. It could cause orofacial pain. So that means anywhere in the face you can have pain. Some of the common ones that I've seen or that I've heard about are when people have like sinus pressure. Sometimes it could be, allergies, but it's really interesting whenever people don't consider that there could be a musculoskeletal issue behind that kind of pressure in the face. Trigeminal neuralgia is another one. We do have a nerve that has 3 different branches. So sometimes when that nerve gets entrapped, it could cause pain all over the face. And then also just dysfunction in this area could also cause headaches. So it doesn't necessarily have to be frontal headache. It could also be more in the back or even at the top of the head. So, a little bit about how your posture, a jaw disorder, and even migraines can be affected by your posture. So, I love showing people this picture in particular. So, if you look at this person, their head is really far forward, which unfortunately, a lot of us with technology, working from home, using our laptops, everything is in front of us. And so, whenever we are oriented too far forward, we call that forward head posture. And so, what ends up happening at the spine, as you can see, it's kind of really extended far forward. And so, what happens at the mandible? So, the mandible is where the teeth are. It pushes the mandible down and towards the back. So that is just what's happening biomechanically. This is what happens whenever you're in that forward head posture. And then you can see it kind of says mouth breather. Not everybody breathes through their mouth, but because of the orientation that your head and your neck is in, and it's pulling the jaw down and back, it kind of opens up your mouth a little bit. And so I don't really see people walking around with their mouth open. So what we tend to do is we want to close our mouth. And so by doing so, that already is overusing a lot of the chewing muscles and creating more stress and strain to the joint. Also, you'll see you have some other muscles that are underneath the mandible and also down in the neck. Those muscles end up getting stretched out as well. That's where you start seeing more of, you can have like a vocal cord dysfunction. You can have like an airway issue where you feel like you can't breathe or you can't swallow. So where your head is positioned is very important if anybody actually also has any other of those conditions. For migraines in particular, migraine is, and I do have another slide where I'll talk about it a little more, but it is still a neurological condition. But you could have musculoskeletal issues going on. So if your head is that far forward, what ends up happening right at the base of the skull, or like where your skull meets your neck, you have all of your cranial nerves. And so those cranial nerves can become compressed by the orientation of the way your head is in. So with migraines in particular, we focus a lot on making sure that we do tend to the posture component or the musculoskeletal component, because it could help reduce the amount of migraines you have. So a little bit more into anatomy. I could talk about this for days, but I just want to give everybody a general idea about what's going on. So the picture on the far left, we have the occiput, which is the skull. And then we have the C1, C2 vertebrae. And then you'll see that the C, so that stands for cervical, that's your cervical spine. It goes from 1 to 7. So the first two vertebrae, super important, especially C1. The atlas has the ability to slide, it has the ability to rotate. And so, unfortunately, when that one is out of alignment, it could cause a lot of issues. It is directly it directly affects the way your jaw joint works. And then with the migraine component, it will directly affect, nerve compression with the orientation that your head could be placed in. The rest of the spine is also important, but we spend a lot of time in making sure that C1 and C2 are always in the proper alignment so that we can make sure that the function of the jaw or even just decompressing the cranial nerves helps with the conditions that we're treating. The middle picture talks a little bit more about that forward head posture that we just discussed. So if you see the green spine, that is your healthy posture. So if you notice, there are curves in the spine and those are supposed to be there. I'm sure like I have a lot of people that come in and they're like, oh, I went and I got an x-ray and they told me that my neck is really straight. So anytime that our head is positioned too far forward, that causes the straightening of the spine. However, I do want to just say that at Mind Body Physiotherapy, we check, it's a full body assessment. We do check the head and the neck first because that's obviously what we're treating. But we do start looking at the middle part of your spine, at the rib cage, and even at the pelvic level, because sometimes it may not be forward head posture. But that can be, education presented if anybody needs an evaluation. For now, we're going to stick to talking about forward head posture and how that can affect the jaw and migraines or tension headaches. But that is just to say, like your spine goes all the way down to your hip, and so you can have a hip alignment issue that could then be causing the middle or the lumbar part or the low back to also have more of a straight orientation to the curve. And then that can have implications on the thoracic spine, which is like the middle portion of your spine, and then ultimately working its way all the way up to the top. So I always tell people, we're all connected. So we want to make sure that if we're not getting results tending to the head and the neck area, that we are looking at the rest of the body. So we have healthy curves. We have the curve in the cervical spine, which is the neck, and the lumbar spine, which is the low back, that go the same direction. And then the thoracic spine, or the area like where your rib cage attaches to towards the back, that has the opposite curve. So those curves are supposed to be there. Unfortunately, we could lose them over time. And so that's what we're here to help with physical therapy. And then the last picture is a little bit about what's going on with your muscles. So we're talking a lot about the joints and what's going on there, but the muscles, you have some that when your head is too far forward, what ends up happening at the neck level in the front, the weak cervical flexors, those muscles are very important to create stability to your C1 and C2. And they also help position the head back or stack it right above the rest of your body. And then what the other muscles that become weak are your rhomboids. You have middle and low rhomboids, middle low traps. So those are the muscles that are right in between your shoulder blades. So I don't know if a lot of you, maybe growing up, your parents would be like, stand up straight, and they wanted you to squeeze your shoulder blades together. So those muscles end up getting weak. That also provide a lot of support to your rib cage and to your thoracic spine and your neck. When you have forward head posture, prolonged forward head posture, those are the ones that end up getting weak. Then you have the tight muscles, so the pecs, so the front of your body, those muscles end up getting a little bit tighter. I don't know if any of you have ever done like a doorway stretch or just lie down on your back and open your arms wide, and you can feel like, oh yeah, like that feels like a really good stretch. So these muscles end up getting a little bit tighter. And then the muscles at the neck level are the suboccipitals, the upper trap, and the levator scap. Suboccipitals are super, those are the muscles that end up getting very shortened. And those are very common complaints with the migraine population, that they just feel like there's a lot of tension and tightness in the back of the neck. And so, fun fact, the suboccipitals actually can refer pain all the way to the front and even into the eye area. So we look a lot for those things. So like referral pain patterns. The upper trap actually refers pain to right above your ear or the temporal region. So I've had so many people too, they're like, my pain is just like on the sides of my head. And then we pinch their upper traps and they're like, wow, that really reproduced my pain. So sometimes we're experiencing pain in one area, but that isn't the area or the muscle that we would target. We would actually look at the other areas and the referral pattern that you're having. All right, so now we're going to talk about tension type headaches versus a migraine. So we collaborate closely with Vertrice Headache Center. She is located here in Austin, Texas. And per her recommendation and also discussion on what they are, a migraine is not a pain syndrome, but a brain syndrome. So it's a headache plus other symptoms. So it involves a very complex cascade, chemical cascade of events. So a headache is typically characterized by dull, steady pain, pressure. It often feels like a tight band around the head, a lot of tightness or tension that you can't get rid of with just stretching. And like a headache or now a migraine would usually be accompanied by symptoms of that aura, which is called, or which could be described as nausea, vomiting, light and sound sensitivity, sensory or visual disturbances, fatigue or irritability. So all of those will be associated with a migraine. So I just wanted to differentiate between those two. But the good thing is that how can PT help a migraine, which is what we already discussed a little bit about from the list of these four. So talking about sleep, talking about stress management, checking your musculoskeletal system and your diet. So PT helps the migraine component, making sure that your cervical spine is in alignment, especially those upper two segments, making sure that we're seeing like, hey, are any of these muscles that refer pain to the head, are any of those tight? And how can we help relax them? Or are any of the posture muscles weak? How can we help you strengthen to get you out of the forward head posture so that you don't sit in a position where you're constantly compressing on the cranial nerves that could be contributing to your migraine. So, and then just also to say, all of these components too are very important for jaw disorders as well. So we all know that sleep is super important. Unfortunately, sometimes not getting in a restful position or not getting restful sleep at night can influence the pain experience. So it could increase your pain levels. Stress is another one. We do touch on it, especially because these two are chronic conditions. And with chronic pain, there is more than one factor going on. So chronic pain is once it's gone on for over 3 months. Acute pain is when, let's say, you just stepped off the curb and you rolled your ankle. That is acute pain. That just happened. And usually it'll go through its normal phase of healing and it heals just fine. Chronic pain, there's other factors that are influencing that. And one of those could be stress. It could be lack of sleep. And then, like we discussed, musculoskeletal already, and then your diet as well. So we refer out for this specific thing that, or lifestyle factor that we could change, because we all we recommend is, tending to a lower inflammatory diet, that kind of stuff, because we're not registered dietitians, so we're not specific, but we're happy to refer you to someone because all of these things contribute to the pain experience. So we'll talk a little bit about jaw symptoms. And so any clicking or popping of the jaw, I have so many people that, think it's totally normal. And honestly, it could be. We can't promise that clicking will go away, but we can definitely assess it and make sure that there isn't an issue going on, with the structures in the actual joint. Also, if you're having decreased range of motion, so if one day you wake up and you're like, whoa, I can't open my mouth, I can't brush my teeth, or I used to be able to eat a sandwich and now I can't open fully, that is another one of the jaw symptoms. If you're having ear pain, fullness, ringing in the ears, so that's tinnitus, it could actually be coming from your jaw. So if you've been to an ENT and they've assessed everything and they're like, we can't find anything from our perspective, I would ask you to come and check and see if it's coming from your jaw, because that's something that we can help with. If you're starting to have headaches or even migraines, sometimes people don't ever have headaches throughout their whole life, and all of a sudden they start developing these conditions. This is another place where we can take a look at the jaw. Malocclusion, that is when your teeth are not fitting properly. So if you put your teeth together gently and you feel like you can feel all of your molars, you have equal contact on both sides, that's great. But if you start feeling like, hey, all of a sudden my jaw isn't fitting, or my teeth aren't fitting the way they used to, it doesn't necessarily mean that your teeth have shifted. It could actually mean that the joint isn't where it needs to be. You do have a disc inside of your jaw. It's like a little meniscus, or it's made out of fibrocartilage, and it's there to provide support. Sometimes that can get out of place and it could feel like, oh, my jaw doesn't feel like it fits anymore. And then again, we can also check the spine. So checking C1, super important, because I actually have had people that are like, hey, my teeth all of a sudden don't fit anymore. And I've helped them with the alignment of C1. And then they sit up and they're like, oh, my teeth fit again. So, sometimes it's not like a full dental thing. It could be musculoskeletal. Fatigue of the facial muscles after chewing or talking. So it isn't normal for your face to feel tired or your cheeks to feel tired after you just finished a meeting, or after you just got done eating. And I think people feel like this is normal, and it really isn't. So just making sure that if you start feeling some of that fatigue, today I'm actually going to show everyone an exercise that can help with this. But yeah, just sometimes getting it checked out and making sure that it's not something more serious. And neck pain. So if you have chronic neck pain, that could also be a jaw symptom. It could be coming from clenching and grinding your teeth. If your teeth aren't fitting the way that they should, again, that cervical spine alignment, super important. So whenever, let's say you've gone to PT before, you've gone to a chiropractor, you get massages, and you're like, man, this neck pain never goes away. Another place where I would love to see if maybe it's actually a jaw symptom. And then some of the causes of this. So sometimes the jaw disorder can come from clenching or grinding of the teeth. And this one is a tough one. A lot of times you do hear people say, oh, it's because of your stress. Let's get that under control. But a lot of times it isn't. We also can see if you might have an airway issue. If you aren't breathing properly, that could cause more clenching and grinding. Again, going back to the spine alignment, making sure that that's where it needs to be. So there's different causes for clenching and grinding. I wouldn't just let somebody tell you, oh, you're really stressed, go get that under control, because sometimes it's not just that. However, it could be stress. And so that's why we talked about on the components, the lifestyle factors. we just discuss it and say, hey, how's your stress level? How are you managing? So it is something to think about, but not the only thing that it could be coming from. Malocclusion, again, could be a symptom. It could also be a cause. It could be a cause when your teeth are actually shifting. So this is something where we would refer out to a dentist for further assessment. Cervical spine alignment, which we've talked a bunch about. Decreased rib mobility. So we take pride in making sure that we also look at the way the rib cage is working. So your ribs attach to your thoracic spine, and that attaches to your cervical spine. So if there's something going on at the rib cage level, we can assess that and address it. So that way that maximizes the results for jaw disorders. Airway obstruction, like I discussed, it could be causing some of the clenching and grinding, which for that we also refer out to. And sometimes scoliosis. So if you have scoliosis or have heard that there is an issue with the spine and the curves and the alignment of that, that could also be one of the things that could be contributing to your jaw disorder. And we would treat it just like anything else. We do have a scoliosis clinic that we refer out to as well. It's called Scolio Austin. And so we do a lot of collaborative work because obviously there's some things that they're going to be able to offer better treatment at. And then we can tackle, the jaw disorder and the upper neck. So like I mentioned before, these can actually be causes for headaches or migraines as well. So not specifically to the jaw disorders.
I have a question actually.
Yeah, go ahead.
About that. So you mentioned that one of the major causes might be musculoskeletal. And I was wondering if, do you have any kind of age limit when people come to you? Because obviously things like scoliosis or some cervical maldevelopment could present at any age. But is there a limit when it could be treated?
No, not for myself. I haven't seen little ones, and I do have pediatric PTs that I can refer to as well if it's something that I'm not comfortable with. So that's the main thing, just to our level of expertise and comfort. But I've seen teenagers. That's probably the youngest I've gotten. I had like a 13-year-old gal that came to see me, and she was actually undergoing orthodontics. And it's actually really important whenever, if they do have braces, that as the teeth are changing, that their body is changing along with it. So no, we can see any age.
Great, thank you.
Yeah, of course. All right. And now we go into the more fun part of this, something that I really like to not only educate people on, the anatomy and all of that, but we also like to teach a few safe exercises that can help manage. This is good for both. It could be good for if you're having tension type headaches, if you're having some orofacial pain, good for TMD conditions as well. So the first one, if anybody's okay with it, or make sure you get your hands washed before we try this. Usually in in-person events I have gloves, but the first massage that we're going to show is actually inside of the mouth. And I've actually found some people say that this is super beneficial just by learning this one. And it's a really good one that we teach all of our jaw patients. So the first one is called intraoral massage. So if your hands are clean and you're willing to try this one out, please try it along. And also you're going to be receiving an email with all of these exercises and videos on how to do them. So the intraoral massage specifically helps with the masseter and your medial pterygoid. So you have 4 chewing muscles. 3 of them are within the jaw, so your masseter, medial, and lateral pterygoid. And then you have another one called the temporalis, which is actually on the side of your head. So for the intraoral massage, you're going to use your thumb. Am I visible as well, or is it just my presentation? Oh, I'm visible too. So with the intraoral massage, you want to use your thumb, and you're going to go to the opposite cheek. So you're going to go inside And then we're going to do kind of like a pinch and pull method. So it's going to look something like this. You want to apply more pressure with the outside finger, not so much with the inside, because the tissue inside of the cheek is tender, or it could, you don't want to cause any bleeding or tearing. And I like to tell people it's kind of like squeezing out a ketchup packet. So thumb goes inside. We want to grab, and then you're going to pinch and pull all the way down. So I tell people, make sure that you start at the very top where your cheekbone is, and then you're going to pinch and pull all the way down to where the mandible is, and make sure you keep scooting back towards where the actual joint is. So we're here. And turn pull. So there's a lot of people that are like, wow, that's really tender in there. If you feel like there's a little bump, totally okay. Sometimes we can develop a trigger point or a knot, just like anywhere else in our body. And I feel like just with those 2 little swipes I did, my cheek already feels better. So we carry a lot of our
It
tension.
does. It's fantastic. It feels like it's filled with air now. It's like the
Yes.
joint is floating.
Yeah. And so this one is super helpful. So for a lot of the people that are like, man, I just finished a meeting and my cheeks just hurt so much, just do some intraoral stretching. Like I said, we'll send a video with myself speaking over the video to demonstrate on how to do it. Make sure you do both sides. I tell people maybe you can do it in the shower, 3 to 5 minutes total. And yeah, it feels really good. I felt it too, just with 2 little swipes. And if it's really sore or tender, I always tell people on a pain scale level from 0 to 10, 10 being the worst, maybe a 4 is the highest you should get to. So you don't want to get in there and go really hard. So that way it provides some relief rather than feeling like, oh my gosh, what did I just do? Alrighty, so if there's no questions on that one, I'll move on to the next one. The next one is called levator scap stretch. So that is one of the muscles that we talked about, tends to get tight in the back. So for this one, just make sure you're seated with your feet are on the ground, and you're going to turn your head towards the right, and then you're going to grab with your hand behind your head gently, and you're going to pull your chin down towards your chest. So what you do here is you're going to take an inhale in through your nose. When you exhale, see if you can pull your chin down just a little closer down towards your chest. Keep holding that, and the stretch should be felt right behind the left side of your neck if you're going towards the right. You can do maybe a couple more breaths, big inhale, and then big exhale. See if you can pull a little more. And let's just practice the other side quickly. So feet are on the ground, turn your head to the left, hand goes up and over, and then tuck your chin down towards your chest. Inhale in through your nose. Exhale, try to pull a little bit lower. Okay. And so again, that same pain level. So if it's a 4, if it gets higher, you're pulling too hard, it should just feel a little uncomfortable and like a stretch, not painful, not sharp, not like you're really pulling your head off your neck. So that's another really good one, a good little break in between your workday. The next one, cervical retractions. I've actually changed it up a little bit. So you don't want to retract the head that far back. I like to call it like it's a little bit more of a chin tuck or a chin nod. So if we're sitting with our head forward here, all we're going to do is we're going to try to stack our head above our shoulders by tucking the chin down. And so this is where I say it's a little bit more of a nod. And this is where we should be our entire day, whether we're walking or we're sitting in front of a computer, our chin should always aim to be parallel to the ground. So once we're here all day long, that's putting us in that forward head posture. Just being a little bit more aware and mindful of that goes a long way. So it's a little chin nod, again, it's called a cervical retraction because you're like kind of pulling the neck back, but I don't want you to pull too far back where you're making your neck straighter. So simple little nod, perfect.
I can
All
actually
right.
feel like 10 different muscles just readjusted just by doing
Yeah,
that. I can feel it everywhere.
I
I
love
guess
that.
I'm guilty of that position.
Yeah. I mean, we all are very forward. Everything is in front of us, unfortunately. So, it's just finding ways to manage it. And then the last one of my favorite ones. So, diaphragmatic breathing. At Mind Body Physiotherapy, we focus a lot on breathing. And sometimes, if you feel like you can't get a full breath of air, it could also be because there's something going on with the rib cage. So that's where we go into assessing that too. And so diaphragmatic breathing, just breathing in general, a lot of us have forgotten how to do that properly. And the benefits behind breathing, there's so many with migraine population specifically, but jaw disorders, I mean, really any chronic pain condition, teaching people how to breathe properly and tapping into that again is very helpful because it's helping you in the nervous system level. So we teach people to fully exhale so that you can get into that yummy feeling of like everything is good right now. My body can reset and relax. So I actually do diaphragmatic breathing with almost every single one of my patients because you can massage someone all day. We also do dry needling. You can do a lot of body work with people. But if you live in the tense position and you can't exhale and you're always on, then all of those things, like they're not going to end up working for longer term. So diaphragmatic breathing, super easy. I want you to place your hands right on your rib cage. And so this is where your breath should come into. Your diaphragm is right behind your rib cage. And it's okay if your belly expands, but I don't want the belly to be the focus of where your breath is going to. So we're going to seal our lips and we're going to breathe in through our nose. And we're going to allow the diaphragm or the rib cage to grow as we inhale. And then as we exhale, I want you to squeeze all the air out, and you can use your hands to help. Try it again. Inhale in through the nose. Rib cage expands. And then as you exhale, push all the air out. And so with that, it should also help get your shoulders down a little bit lower. Whenever you inhale and you try to let the rib cage expand, you get out of breathing through your neck or through your chest. We shouldn't be breathing through there, but a lot of us do. So neck breathing will look like that. And then all of the muscles in your neck tend to be really tense, or with the upper traps. That is not where we should be breathing through. So we should be breathing through the diaphragm, expanding, and then also letting it depress. And that way, whenever you take another breath, everything recoils. So our lungs and our diaphragm and everything in there, they're on a pressure system. So the more we exhale, the better inhale we can get. So I teach this to almost every single of my patients. Like I said, you'd be surprised at how many people we've forgotten how to breathe properly, And so it is very helpful to be able to fully empty everything out to that point where you feel like, okay, my body is shutting off, like my muscles are off, I can relax now. And so that's kind of where we talk about the stress management component. If we're like, hey, if you do feel like your job is a little more stressful, if you had like a rough day with your family, whatever it is, sit back, take a few deep breaths, get yourself into that very deep relaxation mode, and diaphragmatic breathing is great for that. So we'll be getting an email with these exercises so you can review them and practice them throughout the day. Like I said, these are very, bread and butter type exercises that are not going to make either of these conditions worse, whether it's someone with migraines or a jaw disorder. And then last, I just want to talk about when you should seek help from PT. So if your pain lasts more than 3 to 5 days, whether it's at the jaw or you're like, I have this headache that just hasn't gone away, please go to a PT, because a lot of it could just be musculoskeletal. And so we are trained as doctors of physical therapy to refer out when it is not within our scope. But usually if people see changes, within 2 to 4 visits, that their pain is reducing, then we know that it is something that we can help you with. And if it's not, we're going to refer you out to a medical doctor so that they can see where the source of the pain is coming from. If your pain does not change with medication or massage, so if you've gone to get a massage and you're like, it feels good for a few hours, but then it comes back and, I've been taking medication and it isn't quite changing, we are also happy to just take a look at the alignment. You never know. Sometimes it could be something deeper, but again, like I said, we will refer you out if we feel like it's not within our scope. If you're starting to get headaches or migraines, so this is more specifically with jaw disorders. So if you're like, I'm having a little clicking, popping, or, oh, you know what, like I can't open my mouth as wide, but I'm just going to wait and see what happens. But then if you start getting these tension type headaches or like chronic neck pain, please come and get that checked out. You are not able to chew or eat. I cannot believe how many people tell me, oh, you know what, I don't eat salads anymore because it hurts my jaw to eat them. You should have the ability to eat anything that you want without pain or dysfunction. And trust me, I have one person right now in my mind, but several people that have come in and said, hey, I can't eat salads anymore. I can't eat almonds anymore. And we've been able to help them with physical therapy. They're eating salads, they're not having any pain. So that is totally attainable. So please don't feel that, oh, I'm just not going to eat that anymore because it hurts. We can definitely help. If there's any loud popping or clicking sounds, some clicking is totally fine. Like my jaw clicks from time to time a little bit. It could just be muscle tension. So I'll usually do some intraoral stretching or something like that, and it goes away. But it starts getting really loud or it starts becoming painful or sharp. Please get that checked out. If there's decreased range of motion, so again, if you wake up one day and you're like, oh man, I can't open my mouth to like brush my teeth, or if you feel like, oh, I woke up with a crick in my neck and it's just not getting better, I can't turn my head, that's another area we can help with. If you notice that when you open your mouth and your jaw severely deviates to one way or another, that could be an implication to a disc displacement. So I talked about there's a little disc inside of the jaw that is there to provide support, and it's supposed to work with the way your jaw opens and closes. But sometimes when it gets displaced forward, it could cause your jaw to deviate severely. And then numbness, tingling, ear or eye symptoms. So that would be probably a little more for a migraine, but also for the trigeminal neuralgia. Sometimes it feels like your face goes numb, or you start having more of the like ear ringing, or you're starting to have pain in your eyes. Some of this could still be muscle like referred pain, but we're happy to take a look. The goal at the evaluation is to reproduce your symptoms. And if you're like, oh, you pressed here and it gave me that headache, then we know that that's what we need to treat. So sometimes people just, they don't correlate that with physical therapy or muscle tension, but, we see it a lot. So we are just happy to take a look, happy to take a look. And if we feel like we can't help you, we'll definitely refer you somewhere with someone that can. All right. And that is all for today. Any questions?
Well, this was amazing. I learned so much, and I already feel like I relaxed myself down at least 50% because
like
at the end of the week, everyone is, stressed a little. So the exercises you show, I know they're just the tip of the eye, just, a little taste of what physical therapy can do for you. So I have actually 2 questions. The first one, if people found those symptoms and they need to seek physical therapy, how do they start working with you?
Yes, so they can go to my website. It's www.mindbody-physiotherapy.com. Physio is PHYSIO. And all you would do is there is a link there to schedule a discovery call. So this call, we offer everybody a 15-minute consult on the phone. It's completely free to talk about what's going on. And then from there, we feel like we can help you and it's appropriate, then we will get you scheduled.
Great. Is this correct?
That is perfect.
Great. And then the last question, I guess, I didn't want to let you go without sharing some tip of the day. I know you gave us some exercises to work on, but maybe you have tip of the day just from the general perspective of physiotherapist, or maybe things I would never do, knowing what I know. Like common
Yeah.
habits that people do, and you're like, never do that again.
Yeah, I think that honestly, the breathing is such a big thing for us in our practice. I think that so many people forget the power of exhaling. So if there's anything that you can do, exhale as hard as you can. There's so many benefits to breathing, and it's like alerting your body like, hey, it's okay, we can relax, we can calm down, it's going to be okay, because our body keeps track of the tension that we have. So if we can learn to relax and just fully exhale, sit with our breath, that would be great.
Thank you so much. It's super helpful. And I'm encouraging everyone to reach out to Dr. Gonzales and see if your complex problem might have actually a solution after so many years of trial and error.
Yeah,
Thank you so much,
absolutely.
Dr. Gonzales.
Thank you for having me.
Yeah. And everyone, have a great weekend ahead. Bye.